The Tatum approach to helping hospitals face the daunting task of increased self-pay collections, especially at point of service, is really a three-pronged approach, which we like to call the Inc. approach, like incorporated. There's three major activities involved in the Inc. methodology. Number one, it's the identification. Helping hospitals develop protocols, processes, and departments responsible for the identification of the patient responsibility. It's training the staff to use websites, internet services, integrated services to identify how much a patient's responsibility would be at time of service, either at coinsurance or deductible. The second part of the Inc. Is the notification. No one likes a surprise, so it's very important to train the staff and develop a unit that will make outgoing phone calls to notify the patients prior to service. Again, the objective is to mitigate the risk to the facilities or to the physician office. So what we do is have a group of individuals actually call out to the patients, let them know before they come in how much will be expected, either before they come in for service or at the time of service. What we like to do is make sure that we also give consistent messaging to the patient before they come in. What we often find is that we'll call and tell a patient that they have to pay so much at time of service, time of their surgery, to find out later that they didn't bring a check with them or a credit card, and we ask them why. And they tell us, well, the night before the nurse called to tell me what time to come in for surgery, and they said to leave all my valuables at home. And here we told them to bring a check to pay for service. So part of the notification is also consistent messaging throughout the hospital, both from a financial perspective and also when the clinicians call the patient and tell them their expectations when they come in. The third part is the actual collection. It's retraining, retooling folks or staff within the hospital which aren't accustomed to collecting money. They all like to be paid, but they aren't as adept at being good collectors. So we train them, we do extensive scripting and role-playing with folks in the pre-service unit, as well as your frontline access care staff from the emergency room, ensuring that we're consistent with EMTALA standards, to your front-end registration staff, teaching them the appropriate scripting on how to ask for money. What's this lead to? Again, we want to reduce the cost of collections, we want to help improve cash flow to the hospitals, and we also want to try to mitigate bad debt occurrences.